Peace. Welcome to the YouTube live book reading of Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. I'm your moderator and narrator, Uriel Riley. Welcome, YouTube. Peace. So we pick up in a new chapter. It's new chapter time. Happy Thursday. Yes. A moment of silence for all those that we lost or lost to complications of 9/11/2001. I was there. Chapter 13. Pharmacology in Bronchial Hygiene Therapy. Page 209 for everyone in the playlist and reading along. The inhalation of medication has been a mode of therapy for centuries. Adding medical agents to boiling water and inhaling the vapors has been a home remedy since the beginning of recorded history. Camphor, eucalyptus, and tincture of benzoin enjoy popularity to this day. Freon pressurized atomizers for administering bronchodilators are used by hundreds of thousands of asthma sufferers. When not abused, they undoubtedly provide significant relief with little risk. Medicine has adopted the unfortunate belief that IPPB and aerosol therapy are primarily sophisticated and efficient methods of delivering medication. If aerosol and IPPB therapy are being administered primarily for the pharmacologic effects, it is almost certain that those effects can be better and more economically accomplished by methods other than respiratory therapy techniques. Pharmacology is the main therapeutic tool of the pulmonary medicine physician, but is merely a supplement to the respiratory therapist. With the exception of nurses, respiratory therapists are the only recognized non physician practitioners administering drugs to patients. Very key. Welcome, YouTube. Peace. We're in chapter 13. That's just starting off. Welcome. In the middle of page 209 for those reading along. Therefore, they must understand the appropriate administration indications and contraindications of the various agents. Although the respiratory therapist is primarily concerned with the delivery of aerosolized medication, he or she must be familiar with the general field of pulmonary pharmacologic therapy since he or she treats patients who are commonly receiving multiple pharmacologic agents. This chapter is not meant to be a detailed discussion of medical pharmacologic therapy for pulmonary disease. It is meant to be a general exposure to the entire field of pulmonary pharmacology for the respiratory care practitioner. Basic principles of pharmacology. A drug is a chemical compound that affects physiologic and biochemical processes. Ding! We have to drop that pin there, right? That's very key. Hi, it's Heart Love. Thank you so much. Thank you for being here and reading with us. The bottom of page 209. Thank you for the likes and subs. We're pushing towards 1,000 subs on this channel where we read books and learn from masters. So right now we're in the thick of it. Right now, clinical application of respiratory care, a medical book for all those aspiring to be in the medical and respiratory practitioners. So thank you so much for being here. A medication is a drug applied for therapeutic purposes. Pharmacology is the scientific study of drugs and medications in all aspects. Effects and side effects, page 210. Few medications possess specific actions. Most have varied effects on metabolic and physiologic processes. The administration of a medication carries the responsibility of comprehending all of the drug's effects. The physiologic actions of the medication, other than those specifically desired, are termed side effects. See, there we go. For example, if a medication is administered for purposes of affecting the heart, but also affect the lungs, the lung effects are considered side effects. On the other hand, the same medication given for the lung would have its cardiac effects considered side effects. Yes, this is key. We're getting it. Master ourselves, heal ourselves. We can heal others. Thank you so much for being here, Carlos. Hi, it's Heart Love. Yes, medical books. Free on YouTube. This is a $3,500 book. We're giving to you free. Thank you so much, Carlos. Hi, it's Heart Love. Mode of action. The middle of page 210. A medication produces its effect by contacting cellular elements, e.g., receptors, cell membranes, mitochondria. This is accomplished either by direct application or by absorption into the bloodstream. Topical effect. This is very key, guys, especially for you taking notes. This is very key. The topical. That's what we do with the Bogan villas, right? All right, here we go. Topical effect. Medication can be applied directly to the epithelial or mucosal surfaces and have its effect by direct contact. The drug molecules pass through or among the cells to directly contact cellular elements. A topical mode of action is when there is no absorption of drug into the bloodstream. The drug has its effect by direct contact with the cells. This must be distinguished from topically applying a medication to an epithelial mucosal surface with absorption into the bloodstream occurring via the copious blood supply of the epithelium. Systemic absorption. Medications are usually absorbed into the bloodstream and distributed throughout the body tissues where contact is made with cellular elements. Whether the route of delivery is injection, GI tract, or inhalation, the drug is absorbed into the bloodstream and has its effects via that route. Classic pharmacologic study pertains to drugs that have their effect via the bloodstream. Most medications applicable to pulmonary disease act in this manner. Such drugs are traditionally studied in four phases. 1. absorption into the bloodstream. 2. Distribution throughout the body tissues. 3. Metabolic inactivation and destruction. And 4. Excretion. We shall be concerned only with the first of these phases. Routes and administration. Bottom of page 210. Figure 13.1 illustrates the generalizations that may be made pertaining to the rapidity and efficacy of systemic absorption by four routes of administration. 1. Intravenous. 2. Intramuscular. 3. Gastrointestinal. And 4. Inhalation. Right? And when we breathe through the nose, it's going to go right to the center of our brain. Okay, here we go. Figure 13.1 shows the blood levels achieved by equal doses of drug administered, but via different routes. Okay, so it has, you'll see, it has the IV, then the inhalation, and the IM, and the GI. The IM is the intramuscular. Okay, so and the blood level and the time. All right. On the horizontal axis is going to be the time. On the vertical axis is the blood level. So you can see vividly, there's certain things that get it into the bloodstream faster. Okay. So thank you so much for the likes, subs, highest heart love, gratitude. We're reading Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. All right, so there you see figure 13.1. It says blood levels achieved by equal doses of a drug administered via different routes. IV equals intravenous. IM equals intramuscular. GI equals gastrointestinal, pill or liquid. Only direct IV injection achieves a faster and higher blood level than the inhalation route. See that? That's very key, right? Oh, Uriel! Highest heart of Uriel. I love you. Thank you so much, my star brother. Highest heart love. Thank you so much for being here. We found each other. See, we vibrated to one another. Now, divine beings are uniting. The healers are uniting. You see, this is a peaceful channel where we read books and learn from masters. I'm Master Uriel Navarre Riley, and I am a master fitness trainer. I'm sure you're a master, and we honor the masters here. So thank you so much for being here, Carlos, Uriel, all of you. Divine angels, stop right here. Okay, so here we go. Intravenous injection. The fastest and surest method of achieving a drug blood level is by injection directly into a vein. One is assured the total dose will enter the blood, and it will do so rapidly. This is the preferred route of administration in critically ill patients. Intramuscular and subcutaneous injection. The deposition of a drug into a muscle will allow absorption via the copious blood flow. This is usually a dependable method of achieving a blood level as long as general circulation is good. Absorption occurs over a period of time in comparison with the identical IV dose, and a lower blood level will be reached and maintained for a longer time. That's key. That's very key. We look at this chart again. You see the IV, it gets into the blood level fastest, but it doesn't stay that long. I want to, just for the replays and those in the playlist, so you can see. You see the time is shorter for the IV, but it gets into the blood level the fastest at the highest rate. Thank you so much for the likes and subs. This highest heart love. Gratitude. We're pushing to 1,000. Reading medical books, reading anthropology. We started this channel off reading anthropology. So now only the super high level can do this. And that's why Master Uriel here to do it for us. You know, it's a service for the people. So highest heart love. Thank you so much. Yep, it's super high level vocab. Okay, so subcutaneous injection results in slower and less dependable absorption because of the less abundant blood supply to fatty tissues. Gastrointestinal absorption. I'll have all the words in that needed to be put in the description, all right, when I upload. The small intestine is an excellent absorptive surface. The stomach and large intestine less so, but capable of significant absorption. The oral route, pill, or liquid, is by far the most commonly used method of drug administration. Absorption is far slower and less reliable than with IV or IM injection. The convenience, toleration, and safety of the oral route, however, makes it the most widely used route for self administration of medication. Medications may also be given under the tongue, sublingual, or rectally. These routes have the advantage of bypassing the stomach, where many drugs are inactivated or destroyed, right? Because of our long digestive tract. So that's also why it's very important to fast, right? To clean everything out of that gastrointestinal. Inhalation absorption. The lung has more potential surface area for molecular exchange with blood than any other organ. Only intravenous injection is more rapid than inhalation in achieving blood levels of a drug. The greatest absorptive area in the pulmonary system is the lung parenchyma. However, the medication must be delivered to the alveolar surfaces for absorption to take place across the alveolar capillary AC membrane. The tracheobronchial tree has a large mucosal surface area with copious capillary blood flow, so much so that some drugs are rapidly absorbed via this mucosa. Drugs administered via the pulmonary tree may act 1. Topically, 2. By absorption through mucosa or AC membrane, or 3. By both of these mechanisms, with the exception of the mucolytic and decongestant drugs. Most medications delivered by aerosol may be as effective when administered by another route. Most inhalation drugs are administered because it is a convenient and safe method of self administration. It is a common misunderstanding to assume that drugs administered by inhalation are working topically. The opposite is usually true. The lung and tracheobronchial tree are being used as a mechanism for rapid systemic absorption. And we'll pause right here. Continue back. We'll reconvene with chapter 13 of clinical application of respiratory care. I'm your moderator and narrator, Uriel Riley. Thank you so much for reading with us. Thank you for being here in concert. This beautiful book we're reading right now, shaking it up in the world, right? Reading books on YouTube, it's like, oh, yes, takes a very high vocabulary. Yes, that's right. Love to all our family and friends. Love to all the birthdays of September 11th. Jackie, highest heart love. You're forever captured on the Love Over Hate album. Thank you so much for being such a beautiful friend. Love to all of your friends out there as well. Virgo season is strong. We're balancing, right? We just came out of the fire, balancing, grounding ourselves with the earth. Ooh, I love you. Love you. I love you. I love you. Highest heart love. Thank you for breathing with me. Thank you for reading with me. So, all those that have made it this far, and all of those that we have lost on our way, this one's for you. Drink of love water. We love you so much. You are with us now, always in our hearts. Highest heart. Mm, thank you. So grateful. Thank you. I love you. I love you. I love you. I love you. So grateful and thankful for all I have right now and all that is coming to me. I'm ready to receive. I believe. I know it. I deserve it. I love it. And I love you. Thank you so much. Thank you so much. You said subscribe. Yes. Much love. You know, we read books. Well, it's the peaceful part of YouTube, right? It's the peaceful part. We show love to one another. We uplift one another, and we help everyone level up. That's what mastering ourselves is for, so we can level up, right? So, highest heart love. I love you, Bubbles, Isis. I love you so much. All my nieces and nephews, I love you. Highest heart love. I love you. You know it, because I love myself. Peace, peace. I'll see you soon.